member for Innisfail-Sylvan Lake.
Thank you, Mr. Speaker. Slave Lake is in serious trouble. In 2011, the community of Slave Lake had doctors, a surgeon, an anesthesiologist, a full dialysis unit, and a functioning operating room to meet patient needs. These services are essential because Slave Lake faces high birth rates and also high mortality rates, close to double the provincial average. Being a young and growing remote community means there is a critical need for urgent care services and access to their doctors. In 2012, the Premier decided Slave Lake would play host to her experimental family care clinic idea, an experiment introduced with little consultation, without guidelines, no parameters, and was not even supported by physicians and healthcare professionals across this province. Let's look at the effect of becoming the pet project for the Premier's next big idea. In 2011, Slave Lake had 11 doctors. Today, they have less than half. In fact, they now have a lower doctor-to-patient ratio than the whole country of Nigeria. In 2011, Slave Lake had one anesthesiologist. Today, they have none. In 2011, Slave Lake had a functioning operating room. Today, nothing. In 2011, Slave Lake had a fully functioning dialysis unit. Now the residents have to drive 3 hours to Edmonton. And in 2011, Slave Lake mothers could give birth in their own communities. Not anymore. Despite this, the PC government insists family care clinics are a success. This government talks about everyone having a home in the health care system. But for Slave Lake, that home is somewhere else, not in their own community. The PC government, the Health Minister, Alberta Health Services, has let Slave Lake down. However, there's hope. The Premier, the PC government can respect local decision-making. They can work with their stakeholders, with their community, and they can put this community first. They can swallow their pride. They can admit that the plan to ensure that Slave Lake's family care clinic was a success has failed. They can also offer the community of Slave Lake actual access to primary health care. To the Premier, to the Minister, to Alberta Health Services, it's okay to admit you were wrong. Make this right.